Okay. Hey, everyone. And you might have caught Dave saying his last name because I want to pronounce it right. So you are here at Litvak Leadership, and I am here with my brand new friend, Dave Ferrera, who is having a book June 1st appear on Amazon, and you can go there now and order it. Innovation in Translation, How Big Ideas Really Happen. So I am so excited to have you on the show, Dave. Welcome to the show.
Thanks. I'm excited to be here.
So I got to ask you first. I mean, I got my list of questions that I ask everyone, but I want to know, what is the difference between a BHAG, a big, hairy, audacious goal, and a big idea?
Well, I think big ideas solve a real problem. The first one, that sounds like it's pie in the sky daydreaming. A big idea to me solves a real problem. And if you're not solving a real problem, you have no business being in business.
So let's talk about the first real problem you solved that you were telling me about beforehand when we first, met 10 minutes ago. Tell everyone your story about your entree into entrepreneurism.
Well, in college, and I told this story before, my grandfather died of an ischemic stroke. It was in 1989, and I was studying engineering, but had no real direction as to what I was going to go into, and that really created a shift for me. The neurologist said, "Hey, I don't know what you're studying. Your father said engineering, but there's nothing we can do for your grandfather. You should look into healthcare." And at the time, I only knew what stroke was. I could spell stroke, didn't know really how it affected a patient. As I graduated, I took my first job in Arizona at a small catheter company. So I learned how to make catheters. I was staying in healthcare, but it was for dialysis. I didn't get recruited to go back to Boston, which is where I was from, that area. And I worked for a big public company, and there was an older Chinese scientist there that kept telling me, "Hey, stroke's the future. You got to get involved in stroke. There isn't a therapy for it." 5 years later, I got a call from a recruiter that had a group or two founders who needed this engineer to help them develop a device to treat a hemorrhagic stroke, which is a brain aneurysm or a vessel bursting inside your brain. So I had to develop the delivery system and the implants to get from the groin to the brain. So that was my first real invention, or being part of a real entrepreneurial team, was to develop a device that was to treat a brain aneurysm. It wasn't until another 10 years I was able to co-found a company that developed a device that would have treated my grandfather, and that was called the stent retriever. He died from an ischemic stroke. He had an occlusion in an artery in his brain. It was a blood clot caused from a surgery that he had. And we designed a device that was kind of a cage-like stent that would compress against the occlusion, and the physician could just drag it out of the head. And that is
that's what we
right. We're like, ooh. And
that sounds like you wake up after surgery and you're like, "Holy, what did you do to me?"
Well, they can feel it coming out, but it only takes a couple of seconds.
Okay.
But they can't feel it anymore, and blood's restored, and you're back to normal, hopefully, if you get there in time. But that is sort of the standard of care today. So if you have a large vessel occlusion in your brain caused by a blood clot from the heart, what they'll do is they'll put a catheter in place, and then a metal scaffold called a stent retriever. They'll grab the clot and pull it out, and you could be back to home, your family, within days. But if they don't restore blood flow, then you're going to have a full ischemic stroke, and then you're going to be paralyzed, or you could die. But yeah, that was the first big invention that I was involved with, and that was back in 2007.
So when you're working with all these idea people and people who say, "Okay, we got a problem and we need to invent something," obviously you've worked with varying levels of leaders, because just because someone has an idea doesn't mean they're a leader. So tell us about someone that had an idea, but you had to drag it out of it.
Well, there's an idea. There's a physician I'm talking to right now.
Okay.
That had an idea to treat tinnitus, which is the ringing in your ears.
Oh, okay.
So Well, I called it tinnitus, but the physicians call it tinnitus. So we learned something. Hey, I get corrected all the time.
The TV commercials say tinnitus, but that's okay. Go ahead.
I still say it occasionally. So this physician had approached me, got to be 3 years ago now, and was saying that he had treated a patient using a stent in a draining vein behind the ear. And I was like, wow, I've never heard of that before. He's like, yeah, I've treated about a dozen patients and it seems to work. And I was like, you got to file a patent on this. Yeah, I'll get to that, but I do it all the time. Like, well, who does anybody know about this? It's like, I don't publish on it. I said, well, then file a patent. Stop talking about it, file a patent. I met him a year later, still hadn't filed a patent. So I kicked him out of my office at my other guy. I said, I'm not going to talk to you again until you actually file a patent on this. And he did. A month later. He called me, hey, filed a patent. Does it make you happy? So, and here we are a year later, I'm going to be forming a company with him on this big idea. It's a new indication. There isn't any devices approved today to treat tinnitus. And we could be the first ones in the marketplace. And this affects 4 million Americans every year. It's a huge market. It's bigger than heart disease.
In the living room, and it sounds like the locusts are screaming. And I'm like, nope, that's just my ears ringing.
You have you have a kink in one of your draining veins behind your ear that goes back to the heart.
Okay.
So that's what you have. You have a kink. So the blood comes out of the arteries, goes into the head, goes through the cell bed, goes into the sinuses, the veins, and as it drains back down, there's a kink back here. That kink, also due to pressure inside the head, that creates that swooshing sound, which is regulated by your heartbeat. So you can put a stent in there, open it up, it could cure tinnitus or tinnitus.
Well, and correct me if I'm wrong, and I've never had it done, but putting a stent in is like, going and ordering a chocolate sundae nowadays, isn't it? I mean, it's like pretty simple.
It's very routine. And especially if it's on the venous side, not the arterial side, it's even safer. So the only complication actually could be what's called a groin hematoma. It's actually down by your groin where they place the catheter. So that could be the only complication, but there won't be any risk of having a stroke or having a brain hemorrhage. It's a very safe procedure.
Oh, they can't go in like right here and go snip, snip, put it in, and
you could go into the neck, into the jugular vein, and into the radial vein inside your arm and come up this way, or through the femoral vein inside your groin. And
as I tremble with each of these descriptions, I realize why now my son says he will never go into medicine. Just watching me talk to you and those reactions. So when you hear these ideas now, how do you rank an idea as to whether there's value to it or not?
So that's a great question, because you just can't go to market with every idea that you hear. So I first want to make sure that I can get a patent on it.
Okay.
Is it unique? So I'll do a patentability search through the patent office. I'll also search the internet. I'll look at journals. So can I protect it? Okay. Then, is it really solving a problem? And is it a big problem? Is there a market for it? So, how many millions of people and hundreds of thousands of people is it really affecting? So there has to be a market for it. It could be a brand new indication through the FDA, or there could already be an indication, but you have a better solution. Okay. So if it's already approved through the FDA through this indication, that means the government's already paying for it, already has a reimbursement code. Okay. So, and I already have the team. It usually starts, who's your team? Can I get a patent? How big is the market, and who's going to pay for it? So that's kind of the list I go through mentally. Because if I can't get a patent and I'm first to market, then I can be copied. If I can get a patent, but there's no market, then no one's going to buy it. And if no one's going to buy it, then I can't get it paid for. So, who's the team? Can I get a patent, and how big is the market, and who's going to pay for it? I mean, that's kind of the actual fast checklist.
And
make sure you're solving a real problem.
Yeah. Well, so my question is at that point, so is there like a medical Shark Tank group?
Not to my knowledge, but there's societies, and I work in the neurovascular, the neurosurgery society, and there are conferences that we used to attend in person, and now they're actually virtual conferences. But we meet. There's all groups of us that meet. There's engineers and doctors and meet, and we have our discussions. Here in Orange County, we have some local technology societies. There's one here called Octane, and every fall they have a group called the Medical Device Technology Investor Forum, and they'll have a fast pitch competition, which is kind of like a Shark Tank.
Yeah.
You'll bring an idea to Octane. Say you're a new entrepreneur, you don't know how to do this. There's a mentoring group there, and I was actually part of the biomedical team there for several years. We would help them. Okay, let's do a patentability search. Let's ensure that there's a market. Who's going to pay for it? Then let's make a pitch deck. So let's make your kind of 12 magic slides. We'll have you rehearse it, and then we'll have you on stage for 5 minutes. And then there's an hour and a half of these fast pitches. And in the audience, there'll be angel investors, venture capitalists. There'll be strategic companies there. And if they like your idea, well, they'll approach you after the fast pitch. So
who are you more like, Mark Cuban or Mr. Wonderful?
I'm probably more like Mark Cuban.
Okay.
Man, I'm from the Northeast. I call a spade a spade. I try to help people along, but I tend to call a spade pretty quickly. I could be wrong, but at least you know how I'm feeling in the moment. So I'm not wonderful.
So when you look at profiting from COVID, okay, because we're coming up on the 1-year anniversary of then President Trump saying, stay at home for 2 weeks. And then 2 weeks later, he said, stay at home for a month, which was, the scariest. And when I say scariest, the like, holy cow, what is going on kind of scary thing for, I think anyone's ever experienced. But there were some people that throughout COVID found opportunity. Like this show and my streaming has been birthed out of COVID. No COVID, there'd be no Litvak leadership at this moment. You would not be my 119th interview. Would have never happened. So, but when COVID hit, was there a group that you knew of or were involved with where people said, okay, this is scary, this has got to be fixed, but here's some opportunity? Were there conversations like that going on?
The societies that I work in, they're worldwide. So, and these congresses, you have to travel to them, and the content is wonderful, but there's so many presentations and there's so much entertaining. There's exhibitions, so you kind of miss out on quite a bit. I think what the societies that I'm involved with we're able to capitalize on is the actual content. These webinars and seminars, we're able to actually get the content of all the new innovations, or even the data from all the new trials out to the marketplace, and they're all recorded now. So I can go back and watch any presentation, live or tape recorded. So these societies were able to get education out in a broad fashion, and it's also made our business much more efficient. I mean, for me to travel to Europe for a conference days, that's an airplane, it's hotel, it's dinners, it's lunches. I'm jet lagged, I'm tired. I mean, how much am I really retaining? Now, I do miss the interaction of having that discussion, actually showing the prototypes and the real devices, but I'm learning more and more about problems and potential solutions, and actually getting more of the contact that I can reach out to people now than I did a year and a half, 3 years ago. So it's unfortunate COVID occurred, and it's still going on as we all know, but it's seemed to make my business much more efficient. From I'm on many podcasts now. I'm on Zoom meetings. I'm probably on 5 Zoom meetings a day. I'm so much more efficient. So in my business in the healthcare, it's made me much more efficient. I'm more knowledgeable. I'm more educated, and I'm more prepared because I'm not flying for 19 hours, and so I think that industry's helped me a lot. Now I'm working in radiology, so I'm not developing a vaccine or something else. I'm really specific in what I am doing, and this has made me much more efficient.
Oh, I think every industry, if the individual has engaged, has become far more efficient. Just looking at what I do outside of Litvak leadership professionally, I mean, I can have meetings with people in 6 different states in one day, where pre-COVID, it was an event to go there. Now, from this date to that date, and no one would have done video. Now I'd say only about half the people do video, but they'll show up to the Zoom or Teams or whatever you're using, and you can actually show them your deck as like part of the conversation, because you need something to talk about, so you're not eye to eye. So, all right, let's talk about the book. So let's throw the name of the book back up here for everyone. And I'm going to attempt, and I should have done this on the front end, to throw the screen up, but there it should be for everyone to see. There we go. So innovation in translation, how big ideas really happen. So Dave, what is your book about?
It's about how to bring a medical device idea from the napkin to the marketplace and commercialize it. And it's a step-by-step process of identifying a problem, ensuring it's a real problem, creating a solution, filing a patent on that, forming a team to develop the prototypes, raising money, and then developing the product through what's called a design control process, which is regulated by the FDA. Getting it approved, doing a commercialization exercise, doing your limited market release, and then doing a full launch, and then having an exit. Either acquiring the company, having an IPO. So it's a step-by-step process how to do all that, and then weaved in are my stories of success and failure and our growth. How I built teams, how I've traveled the world, introducing my devices to physicians around the world. So it's also the entrepreneurial lifestyle. So I mean, I've been to Israel 6 times. I've been to Buenos Aires. I've been to Japan. There's physicians everywhere. But it's that step-by-step process of how to get the idea and all the way to exit.
So you say it is specifically about medical devices. Are the lessons learned, the lessons laid out that you have for medical devices, are they applicable to someone that has a witty idea?
100%. It's the same process. I mean, you still have to identify that you have a great solution for something. It could be a better pen, right? Or a better Frisbee. And you still want to file a patent. You want to ensure that there is a market for it. You have to raise money or self-invest and bring it to market. There'll be certain regulations in every market to design, develop it. It has to be safe for kids. It has to work. You still have to commercialize it. You could never get it acquired. You just monetize it yourself. But so it's the same process. The healthcare industry is just a little bit more regulated than most other industries, but it's the same process. From going from, say, art to part into the market, it's the same process.
So let's relate it to something that is like all over the news right now, because I'll be honest, my audience is not the medical community. But they are somewhat entrepreneurial and they are definitely leadership focused. So I'm sure you've been reading about NFTs.
I've heard of that.
Okay, it's like, little digital art that people create, upload, put it on, link it to Bitcoin of some sort, and then there's I was going to bring it up, I should have known. But basically, it's loaded in such a way that there's one original, and people cannot copy it. You can tell what the original is.
Oh, that's neat.
So for people to market an idea, would you say that your book is a good development from, like you said, from napkin to market, regardless of the product? You may just be giving more detail because it is medical focused.
Yeah. Any problem or solution or idea you have that you want to own and protect, this book is going to teach you how to do that. I think a lot of people are afraid of filing patents. They're expensive. It takes so long. Well, it's going to be really expensive if you take your idea to market and somebody else copies it, like a big company, and you have no IP protection. You don't have a patent. That's expensive because then you put your own money into it. Well, you should put your money into getting a patent first, or ensuring that you can get a patent. And if you can't get a patent, then I wouldn't bring it to market in most cases. So if you have a great idea, you're in love with it, it brings you joy, that's the problem. I was sad, now I'm happy. Okay, file a patent on that, right? And that's another reason to bring something to market. Create joy, help people. It isn't just medical devices. I mean, our smartphones, they bring us joy, they bring us sorrow too. But any technology, any widget could just make the world a better place. It could end pain and suffering. It could improve the length of life. File a patent, or don't bring it to market. So
what do you think is an idea that you've heard people ban, without you violating any trusts, that you've heard? What do you think is a problem out there, whether it is in the medical world or just in life, that someone needs to solve, that you're just waiting to see a solution appear?
Well, there's an area that is becoming of age now that I saw a decade ago, but I didn't know how it was going to actually become part of healthcare, and that was AI. And AI is huge, and then it became virtual reality. There's all these game shows, and you have AI. How can you bring that to healthcare safely? Well, there's another kind of merging of that. It's called AR, augmented reality, and there's a couple companies that I'm aware of are using that technology now to bring devices into the body and treat diseases. And the problem that AR can potentially solve, or I actually think it actually will solve, when you're in a radiology suite, radiology is a form of radiation. So in order for a doctor to see inside your body, you have to lie on a table that is throwing radiation through your body and actually being captured by what's called a flat plane detector. And you can't be in there forever, or else you'll burn the skin and so forth. So this augmented reality will be able to use, CT or MR, and you can navigate through the body with the doctor wearing the goggles. And that's being developed right now. And that's going to improve the safety of the procedure. It's going to improve the speed of the procedure. So that's something that came about, years ago. You're watching, Star Wars and, these other virtual reality movies or these AI movies. How's that going to come into healthcare to improve safety and speed? And that is something that I'm anxious to see really come to the marketplace.
Interesting. So what motivated you to take all of your life secrets and put them into a book?
Well, this is only the first book. So this is only a few secrets, right? Okay. Or a few stories of my life. I like teaching people, and I think what I do, it's a lot of fun, and it's a lot of hard work. And I've met so many wonderful people in my career. I've been in this market now for over 30 years, and I've only been in the neurovascular field. So I've met so many great people, physicians, engineers, patients, that I think this could be inspiring to kids in college today. Hey, I can get into healthcare. I can design medical devices, but I can also own my own company and still work as part of a team. So this is hopefully it's a motivational book as much as it is a how-to book. But it's, there's so many ways. My 7-year-old son the other day, we're driving in the car and he's like, Dad, I don't want to be a police officer. I'm like, okay. I don't want to be a fireman. I'm like, okay. Like, why are we having this conversation? I don't know. Shouldn't I decide now? I'm like, no. I didn't know I was going to be doing this till I was probably 25.
Shouldn't I decide now? What kind of pressure are you putting on that kid?
I don't know where we got this from, but so hey, you can work in healthcare, you can solve big problems and have fun, bring joy to people. So if this inspires people to do it and kind of shows them how I've been doing it, then maybe it creates more entrepreneurs, because I think we need that.
So when you look at, since you're from idea to market, and you've explained, have the idea, is there a market for it? Can you make money at it? My next question is, how do you actually market these ideas? I mean, you're not going on, LinkedIn, Twitter, Pinterest, and Facebook marketing this stuff, right?
Not at all. No. So, I mean, these ideas start with the innovator, and the innovator is really the physician. The physician encounters this problem every day. And if that one physician has the problem, then there's several others. So we'll usually form a strategic advisory board of several physicians. And then, as we're designing and developing, these physicians are actually testing it. When we go to the marketplace, our first marketing is really, I'd say, 10 or 15 hospitals. That's it. So let's make sure that it does work safely and it does what it's supposed to do. And if all those things actually work, then one or two of the physicians will actually make a PowerPoint presentation or even do a journal article. And the PowerPoint can be presented at, say, a major conference. The journal article is sent out in major journals. That's our initial form of actual marketing. Then we may do a clinical trial. Will involve maybe 30 or 40 hospital centers. So that's our way of actual marketing. When you're approved, you have a website, you'll attend conferences, but the way you market healthcare devices is really, direct through your society targeted physicians, either through the journals they read, the conferences that they would attend. And you see devices on television that are, the copper fit, right? I mean, it's not a medical device.
Right.
But who doesn't have knee or back pain when you're over 40 years old? I mean, most of America do. So that's how you market those devices. But if you have a brain aneurysm or an ischemic stroke, you're not going to market it on TV, on ESPN. So it's really direct and target marketing to the physicians, either through our society conferences or journals, or it's it's right to the customer.
So there's not the medical channel somewhere or the medical stream. Not yet. Not yet. Okay. So and you're not going to have like Kim Kardashian, talk about it on Instagram and hold it in her hand or anything.
Well, it's funny you bring that up. You guys remember Sharon Stone, the actress?
Yeah.
Yeah. Well, she had a ruptured brain aneurysm about 20 years ago.
Okay.
And she became an advocate or a spokesperson for the American Heart Association and the American Stroke Association. So she was nationwide. If you were part of that foundation or saw billboards on highways, you would have seen her 20 or 15 years ago. But
interesting.
That's as most as we get with a celebrity in our field.
Wow. So when you look at the people that you have come into contact with, like I said to you when we first started talking before the show began, how after you explained what you did, I said, "Oh, you're the guy that I'll be having a hamburger with." And 10 minutes in, I say, "You're really smarter than me," and you're like, "Yeah, whatever." But when you're sitting down with these visionaries that are coming up with these ideas, do you ever find yourself sitting there going, "Okay, this guy's really, or this guy or woman really has this figured out"?
Well, it's intimidating because the physician you're talking to, I mean, they have the problem. And they wouldn't have come up with this, what they think is the idea for a solution, if it really didn't bother them or their patients. So in most cases, they don't have it figured out. They're saying, hey, listen, this is the problem I have, and I don't know how to solve it. I have an idea. Can we discuss it? And usually that's the napkin sketch, or that's the yellow pad. I mean, they know the physiology, they know the anatomy, they know the bad things that can happen. So they have all that figured out. The device and the engineering side, they're like 25 or 30% there, and that's where the engineers come in. And okay, we meet on the bridge. But
right.
Yeah, I mean, sometimes it can be very intimidating because these are smart people, but they also think that we're smart, so it makes a good team.
It's a bunch of smart people sitting together, solving the medical woes of the world.
It's fun.
It sounds like it. So, Dave, we've reached 31 minutes in our 30-minute show. So this is the part of the show where I turn it over to you for a couple minutes, and I want you to address the audience directly, either those that are here or those that'll be watching on replay. And I want you to give them some encouraging words about what to do with the innovations that they come up with.
Well, I said a little bit earlier, I think there are so many ideas out there that can solve big problems. And some people think that they've already been invented. Well, most of them haven't. And an invention is getting a patent. So the most important thing you can do if you believe that your idea really does solve a big problem is to find a patent attorney and file for a provisional patent. And that's the first step in bringing your big solution to the marketplace. Because, not everything has been invented. So, make sure you believe in that. And I think we're all creators. We all want to do good. We all want to develop something and bring to the marketplace to either help our family member, a friend, our kids, or just bring joy in general. It starts with filing a patent. And if you can file a patent, that's the first step of value creation. You create value, it will be easier to raise money. If you can raise money, you can make your prototype, bring it to the marketplace. You can commercialize it. You can help people and exit. And then you can do it again. That's the process. And there's no special way to do it. This is a simple way to do it. And it's been happening for 100 years. So
fantastic. That's great. That is great. So everyone, Dave's book is Innovation in Translation, How Big Ideas Really Happen. You can go to Amazon now, and on June 1st, they will ship it out to you. So order those books now. If you order it on Kindle, bam, it'll appear on June 1st, I would assume. Yeah. Or like me, I like touching pages. Order the hardback book so you can draw lines on it and write notes. And yeah, I know you can do that with your Kindle, but I never go back and look at those books. So Dave, thank you very much for being on the show today. It was an interesting conversation, definitely a topic that we have not covered, and you really have a handle on innovation from, as you said, napkin to market.
Thank you.
So everyone else, that's Litvak Leadership for today. Join us tomorrow. So tomorrow we have a returning guest. Yes, the one, the only, the legend in the pizza community, Paulie G, is coming back. So, it's supposed to be a half-hour show, but it's never a half hour with Paulie G. So everyone have a great day and come back and join us tomorrow. Be blessed. See ya.